Weekly monoclonal antibody appointments will be increasing. Mall of America vaccination site to increase capacity to up to 2,000 doses per day. Governor Walz requested that the Federal Emergency Management Agency, known as FEMA, medical team to bolster the administration's strategy of providing even more COVID-19 tools to Minnesotans by vaccinating everyone who is eligible and providing life-saving treatments for those who are sick. Governor Walz comments, "We have very powerful tools at our disposal to fight COVID-19. Getting vaccinated is the best way to protect yourself and others from the virus, and treatments like monoclonal antibodies can help sick Minnesotans get better." To make sure more Minnesotans can access these life-saving vaccines and treatments, we requested and have received significant support from FEMA. I am grateful for our ongoing partnership with the Biden administration, and I urge Minnesotans to take advantage of these opportunities to stay safe from COVID-19. Get your shot if you haven't yet, go get a booster right away if you're eligible, and get tested if you're feeling ill so you can get the treatment that you need. Lieutenant Governor Flanagan says, "I am continually impressed by Minnesotans' strong interest in getting their children vaccinated and receiving their booster shots. I am deeply thankful for effective COVID-19 treatments like monoclonal antibodies." This FEMA team will help more Minnesotans get their shot and receive treatment if they need it. I thank the Biden administration and the federal doctors and nurses for making these resources available here in our state. In total, 16 FEMA personnel are arriving in Minnesota this week to support vaccination and monoclonal antibody treatment efforts. With the FEMA team's arrival, capacity at the Mall of America vaccination site will increase from 1,500 doses per day to 2,000 doses. The site is a popular location for Minnesota families seeking vaccinations for 5 to 11-year-olds, as well as fully vaccinated Minnesotans seeking boosters. Since November 3rd, the site has administered nearly 14,000 doses to 5 to 11-year-olds, and it administered nearly 800 booster doses to adults last week alone. Minnesotans aged 12 and up are also receiving their primary series of the vaccine at MOA. The FEMA team will also allow more COVID-19 patients in central Minnesota to receive the monoclonal antibody treatment. The administration and medical providers around the state are working to increase accessibility of the monoclonal antibody treatments. Minnesota has been administering around 2,000 doses of treatment per week since the beginning of October, and this has been increasing in the recent weeks. For the week ending in November 24th, providers administered over 3,000 infusions for the first time. Last week, MDH expanded hours and capacity at its St. Paul Clinic, and M Health Fairview added about 300 patients for monoclonal antibody treatment at its Columbia Heights Clinic. Together, the measures increased Twin Cities' monoclonal antibody treatment by 50% capacity. With FEMA team's arrival, Minnesota will be able to further expand monoclonal antibody treatment capacity. Patients and their providers seeking antibody treatments can use the state's online tool, the Minnesota Resource Allocation Platform, also known as MNRAP, MNRAP. That helps match those who need treatment most with available appointments. When the demand for the antibody treatment increases, as they have recently, the Minnesota healthcare system will give priority to treating patients who are ill and who have the highest risk of developing severe illness and require hospital admission. These sites are not open for walk-in appointments. COVID-19 monoclonal antibody treatment can help qualifying patients get better faster. It is an outpatient treatment for patients with mild to moderate symptoms that started within the past 10 days, who themselves are at a high risk of their illness leading to a hospitalization or death. You can learn more at the webpage COVID-19 Medication Options link. Jan Malcolm mentioned that the antibody treatments are an important tool, but they are not a substitute for vaccination. All those who are eligible should get vaccinated. We are working to ensure that every Minnesotan has fair and equitable access to COVID-19 vaccines and antibody treatments. Capacity in our healthcare system is still very tight, so we are thankful for the support of these FEMA staff who are helping to bolster our capacity. We also need all Minnesotans to take steps to prevent the spread of COVID-19 by getting vaccinated and using other layers of mitigation, such as masking, so that we have the healthcare capacity available to provide COVID-19 treatments to those who really need them.